I'm Sheena Larson, and this is Molly. We're going to be performing a cohat on her today. And I'm going to be starting off by doing the pre-anesthetic exam. So I'm going to check her occlusion. And you can see here, if she sticks her little tongue back in, that she has a class 3 malocclusion. And quite a bit of calculus buildup, bit of gingivitis, and I'm also going to check to see if there's any signs of swelling or anything, and her face appears symmetrical, so I'm not noting anything super abnormal. I don't feel any lymph node enlargement, so going to check with Dr. Dickinson on what he wanted for pre-anesthetic diagnostics, and we'll get her ready for the rest of her cohat. I'm Sheena Larson. This is Molly, and this is my clinical mentor, Dr. Dickinson. We're going to be continuing with her cohat. So for my safety, I'm wearing exam gloves, the surgical cap, eye protection, and a lab coat, and everyone who is within 3 feet is wearing a mask. And to keep little Molly safe, we have her on a warm water table, and she's covered in towels to help her with thermal regulation, and Amy is monitoring anesthesia, so she has the Doppler and the pulse ox, and checking the blood pressure so that we can make sure that Molly is safe for this procedure. So now that we've determined that she is safe, is stable under anesthetic, I'm going to do the soft tissue exam. So I'm going to check for any abnormalities on her lips, on her cheeks, on her tongue, in the sublingual area, on her gingiva, and other than some gingivitis and some already missing teeth, which we had known about from her history, there's nothing clear that is missing, and I'm going to be doing my cohat on the buccal aspect of the 200s and the palatal aspect of the 100s. Now I'm going to start with charting her teeth, and I'm going to start that off by counting what's there. So starting off, I'll go with the 100s. She's missing 101, 102, 103 is there, 104 is there, missing 105, missing 106, 107 is there, 108 is there, missing 109, and missing 110. For the 200s, she is missing 201, 202, 203 is there, 204 is there, 205 is missing, 206 is missing, 207 is there, 208 is there, 209 is missing, and 210 is missing. So now I'm going to be using the periodontal probe, and I'm going to be checking the sulcus steps. So I'm just going to gently insert it into the sulcus and note if anything is greater than 3 millimeters. So I'm just gently lifting it up and moving it around the tooth. There's about a 5mm pocket at the front of 204 at the mesial aspect.
How big?
5mm.
Okay.
And I'm making sure to use the modified pen grip with this periodontal probe. There's 2mm of gingival recession on the buccal aspect of 208. And a 4mm pocket on the distal aspect of 208. Just making sure that my light was working. So I'm just moving the probe down the sulcus, checking around each tooth. There we go. And for the buccal aspect of the 200s, I would say that there's moderate calculus. And for the palatal aspect of the 100s, I would say that there's slight calculus. And for the remaining teeth, I would have gingivitis of 1 to 2 for the 3 and the 4. We'll go 2, and then I'll go gingivitis of 1 for 7 and 8. And for the palatal aspect, gingivitis index of 1 for the 3, 4, 7, and 8. The 3, 4 for the 100s.
Yeah.
Yeah. 3, 4, 7, and 8 have a gingivitis index of 1.
Okay.
Currently, I can't see any furcation exposure, and there's no clear fractures or pulp exposure, but when we remove this calculus, we might have to change what we see. And now I'm going to do some plaque reduction. I could brush her teeth and whatnot here, but since she doesn't have that much, I'm just going to use my 12 ml syringe full of Dentachlor. And I am just going to put some of this onto each tooth, and then that can sit onto each tooth, and that helps to reduce the bacterial load. And going to prep her for full mouth radiographs. So now I'm going to be moving on to the supra and subgingival scaling. So I have our piezo scaler here, and I'm going to be holding it using a modified pen grip, and I'm always going to work coronally. And I'm just going to start by getting rid of the bulk of the calculus. So I'm going to be using my finger as a fulcrum, and then I never want to spend more than 10 seconds on a tooth. Her head is angled down. I have a towel underneath her neck so that the water runs forward. And again, I'm using a modified pen grip. And I do not use the ultrasonic scaler to go underneath the gum line. Since she only has 4 teeth in the 200s, I'm finding that there's not much to rotate and go around. There. And since I got the bulk of that with the ultrasonic scaler, I'm going to move and I'm going to take my universal scaler here, and I'm going to get the remainder of the tooth. So I'm going to be holding this using the modified pen technique, using my ring finger as a fulcrum. And I'm just going to place the cutting edge against the teeth and pull cornally. This is another one that I don't use subgingivally. To get into each of these grooves, I'm using the hand tools and not the ultrasonic scaler. I have more control with the hand tools. There we go. But now that I pulled that off, I'm going to go back and I'm just going to use the ultrasonic scaler. There we go. Going back to the hand scaler, and I'm just going to get those little grooves there. Now I'm going to move on to the subgingival scaling, and I'm going to be using the universal curette. So what I'm going to be doing here is I'm going to put the back of the foot, back of the curette under, and then rotate so that the cutting edge is against the tooth, and I'm going to pull towards me, and I'm going to repeat that, and I will use that to clean subgingivally, to scale subgingivally, sorry, using the modified pen technique. So I go back, rotating and pulling. There we go. So now I'm going to check to make sure that I've gotten all of the calculus. So for that, I am going to be using the Shepherd's Hook Explorer, so on the opposite end of the periodontal probe. And I'm just going to be sliding this along, checking super and subgingivally for any remnants of calculus. Also holding onto this one with the modified pen technique. And it's feeling like it's going up against smooth glass. So I can't feel as though any tartar was missed. So now I'm going to move on to polishing. So I have my little Profi cup here. And on our low speed handpiece, I have the little Profi cup. So I'm also going to be holding the low-speed handpiece with a modified pen grip. And my little prophy cup is wanting to pop out of the ring. There we go. I'm constantly going to be refilling the little prophy cup. So I want to start off cornally, and that's going to push it flat so I can scale, or so I can polish underneath into the sulcus. And again, I only want to spend less than 10 seconds on each tooth.
Good as always.
There. So now I can, with the prophy paste sitting on the teeth, we have polished each surface of the tooth. I made sure to get the root and the distal and mesial aspects, as well as the buccal aspects here, and the palatal aspects of the 100. So I'm going to be using my water air syringe, and I'm just going to rinse everything going forward. Making sure that that's flushing out of her mouth. And I'm going to apply some more Dentachlor. And I am just going to recheck the gingival recession using the periodontal probe, now that we can see here. And for the gingival recession, I would for 208, I would actually say that it's 6 millimeters of gingival recession, not 2 or whatever it was that I had said before. It's quite extensive. For 208, 6 millimeters of gingival recession. But there's no furcation exposure on any of the teeth. And the rest of the values all seem accurate, so I can report this to Dr. Dickinson, and he can undergo whatever treatments he would like. If there's going to be any extractions we could place the nerve blocks if that is what Dr. Dickinson would like. And after he does the treatments, then we would finish the other 4 quadrants, recover her, and make sure that she gets sent home with any to-go home care and medication that she needs.